I think that the Dawn trial basically showed us that in carefully selected patients, that intervention out to 24 hours is viable. In fact, in our institution, we don't pay much attention to the time as a limiting factor. We're more concerned about the perfusion imaging. If the patient had viable brain by perfusion imaging out to 48 hours, we would go ahead in selected patients to remove the clot. So it's extremely important to understand which patients are going to potentially do well with stroke intervention and which patients have a high incidence of failure. And the Dawn trial helped us to discern that. If you look at stroke intervention as kind of the next horizon in medicine, which I think it is, I think that the demonstration that clot removal in the brain with an acute stroke is actually very similar to clot removal or stenting in the coronary arteries with a myocardial infarction. If we look at that, we have to think about, okay, how are we going to solve this problem worldwide? There are between 16 and 17 million strokes worldwide every year. My guess is there aren't more than a couple thousand neurointerventionalists worldwide. What they need to understand is that much of what interventional cardiologists and radiologists do day in and day out is to open up occluded or nearly occluded vessels. That's what they do for a living, whereas most neurointerventionalists are more focused on aneurysms and vascular malformations and so forth. That means that if you can train these other specialists the peculiarities of the cerebral circulation, the fragility of the vessels, the access issues, they ought to be extremely good at treating stroke. Add that to the fact that the technology is evolving very rapidly for acute stroke now. And I think that the procedures itself are getting easier and easier because of the better technology. So I think when you consider all those factors, from my perspective, the ideal solution is to include interventional cardiologists, radiologists, and vascular surgeons on a stroke team if they have the interest. Have them work with the neurointerventionists in the larger centers where they're prevalent and learn from the interventional neuro people how to best treat stroke. And then that can spread out into the smaller communities, and we can create training centers for all these other interventionalists who are closer to the patients, because we know that the time factor from onset of stroke to opening of the artery, revascularization, is very critical. And the best results are within the first couple of hours. And then the results tail off very rapidly all the way down to 6 hours. So it's really important to consider the time factor is the most important thing to consider in the treatment of stroke. The only way we're going to solve this problem is by training interventionalists in outlying areas who can handle the stroke on the spot. Then if the patient has something complicated, he could be transferred to a major neuro center. But if it's an uncomplicated clot removal and an acute stroke, then the patient's probably going to be fine immediately afterward.